Doctor, I am worried. I have had a fever for days and I feel so weak. It's not just the fever, it's this overwhelming sense of fatigue that I can't shake off. Every day feels like a struggle just to get out of bed. I have also been having these terrible headaches and muscle aches. The pain is so intense that sometimes I can't even think straight. It's like a constant throbbing in my head and my muscles feel like they're on fire. I even started bruising easily, and my nose has been bleeding. The bruises appear out of nowhere and the nosebleeds are frequent and hard to stop. It's really frightening. The doctor listened patiently, his calm demeanor already offering a sense of solace to the distressed individual. He knew that his role was not just to diagnose but also to provide comfort and reassurance. I understand you are scared. Tell me, have you traveled recently, or have you been in contact with anyone who has been unwell? It's important to consider all possible factors that could be contributing to your symptoms. No, I haven't traveled anywhere recently, and I haven't been around anyone sick. I've been very careful, especially with everything going on in the world right now. Alright, let's not jump to conclusions. It's easy to let our minds wander to the worst-case scenarios, but we need to stay focused and methodical. We need to gather more information and run some tests to understand what's going on. This will help us pinpoint the exact cause of your symptoms and determine the best course of action. We will start with some blood tests and possibly a few imaging studies. This will give us a clearer picture of your overall health and help us identify any underlying issues. In the meantime, try to rest as much as possible and stay hydrated. It's important to take care of yourself while we work on finding the answers. The patient nodded, feeling a bit more at ease knowing that the doctor was taking their concerns seriously and was committed to finding a solution. The journey to recovery had begun, and with the doctor's guidance, there was hope on the horizon. As the patient left the doctor's office, there was a sense of relief. The path ahead might be uncertain, but with the right support and medical care, they felt more confident in facing whatever challenges lay ahead. Before we delve deeper, it's important to understand that viral hemorrhagic fevers are a group of illnesses caused by different viruses. These viruses can affect multiple organ systems in the body. How do people get these viruses, doctor? The transmission methods vary depending on the specific virus. Some are spread through contact with infected animals like rodents or insects. Others can be transmitted through direct contact with an infected person's bodily fluids. That sounds scary. Now, you mentioned having fever, headaches, muscle aches, easy bruising, and nosebleeds. These can be symptoms of viral hemorrhagic fever, but they can also be indicative of other, less serious conditions. What are some other symptoms I should be aware of? Other common symptoms include fatigue, dizziness, nausea, vomiting, diarrhea, and abdominal pain. In severe cases, patients may experience bleeding from the gums, eyes, or internal organs. Bleeding from the eyes? That sounds terrifying. It's understandable that you are concerned. If left untreated, viral hemorrhagic fever can lead to serious complications. Complications? Yes, these complications can include organ failure, shock, and even death in some cases. The gravity of the situation hung heavy in the air. The patient's face paled at the mention of such dire possibilities. Section 5. Tests and diagnosis. The first step to recovery. This is often the most daunting part of the journey, but it's also the most crucial. Understanding what lies ahead can make a significant difference in how one approaches the path to wellness. However, it's crucial to remember that early diagnosis and treatment significantly improve the chances of recovery. The sooner we identify the issue, the sooner we can start working on a solution tailored specifically for you. The doctor quickly added, sensing the patient's rising panic. It's natural to feel overwhelmed, but remember, you're not alone in this. We are here to guide you every step of the way. So, what kind of tests will I need to have? The patient asked, trying to grasp the full scope of what was to come. The patient questioned, their voice small and shaky. It was clear that the uncertainty was weighing heavily on their mind. We'll need to conduct some blood tests to confirm the diagnosis. These tests are essential as they provide us with a clearer picture of what's happening inside your body. The doctor explained patiently, understanding the importance of clear communication in such a stressful time. It's not just about the tests. It's about ensuring you understand each step. These tests will help us identify the specific virus causing your symptoms, which is essential for determining the most effective course of treatment. Without this information, we would be navigating in the dark. How long will it take to get the test results? the patient asked, their concern evident in their eyes. The waiting period can often be the hardest part. The patient inquired, their anxiety still lingering. The unknown can be a terrifying place, but with the right support, it becomes manageable. The doctor reassured them that they would do everything possible to expedite the process and keep them informed every step of the way. Typically, it takes a few days to a week to get the results back, depending on the complexity of the tests. During this time, it's important to take care of yourself and try to stay positive. "Thank you, doctor," the patient said, feeling a bit more at ease knowing what to expect. The first step to recovery is always the hardest, but with the right information and support, it becomes a journey of hope and healing. The doctor smiled, offering a reassuring handshake. "Remember, this is just the beginning. With each step, you'll get closer to recovery. Stay strong, stay informed, and most importantly, stay hopeful." As the patient left the office, they felt a renewed sense of determination. The road ahead might be long, but with the right mindset and support, they knew they could face whatever came their way. And so, the first step to recovery was taken, marking the beginning of a journey towards health and well-being. Section 6. Treatment and Management. This section delves into the various approaches and strategies employed to manage and treat the condition effectively. The time it takes to get the results can vary, the doctor reassured. It's important to stay patient during this period, as the results will guide us in tailoring the most effective treatment plan for you. But in the meantime, we can start you on supportive care to manage your symptoms. This includes a range of interventions aimed at alleviating discomfort and preventing complications. "What kind of supportive care?" the patient asked, hoping for some relief from their discomfort. The patient was eager to understand what measures could be taken immediately to improve their condition. "We'll focus on keeping you hydrated, managing your fever, and ensuring that your vital signs remain stable. Hydration is crucial as it helps in maintaining bodily functions and can prevent further complications. And addressing any other symptoms you may be experiencing," the doctor explained. "This could include pain management, nutritional support, and monitoring for any signs of worsening conditions. Depending on the specific virus, antiviral medications might also be an option. These medications can help to reduce the severity and duration of the illness, making a significant difference in the recovery process." A glimmer of hope flickered in the patient's eyes. The possibility of effective treatment brought a sense of relief and optimism. Knowing that there were treatment possibilities provided some comfort amidst the uncertainty. The patient felt reassured that they were in capable hands and that every effort was being made to ensure their recovery. The medical team worked collaboratively to devise a comprehensive treatment plan. This plan was tailored to the patient's specific needs, taking into account their medical history and current condition. Regular monitoring and adjustments to the treatment plan were essential. The healthcare team remained vigilant, ready to make changes as needed based on the patient's progress and response to treatment. The patient appreciated the continuous support and care provided by the medical staff. This ongoing attention played a crucial role in their journey towards recovery. Clear communication about the next steps in the treatment process helped the patient feel more in control. Understanding what to expect reduced anxiety and fostered a sense of partnership in their care. As the patient settled into the treatment routine, they began to feel more at ease. The structured approach to their care provided a sense of stability and hope for the future. The patient's family was kept informed throughout the process, which was crucial for their peace of mind. Knowing that their loved one was receiving the best possible care brought them comfort and reassurance. Gradually, signs of improvement began to emerge. Each small victory was celebrated by the patient and the medical team, reinforcing the effectiveness of the treatment plan. The patient expressed deep gratitude for the dedication and expertise of the healthcare professionals. Their unwavering support made a significant difference in the patient's recovery journey. Eventually, the day came when the patient was well enough to be discharged. The journey had been challenging, but with the right treatment and management, they were on the path to full recovery. Follow-up visits ensured that the patient continued to progress well. Ongoing care and monitoring were essential to maintain their health and prevent any potential setbacks. With the support of their family and the medical team, the patient was able to return to a normal, healthy life. The experience underscored the importance of effective treatment and compassionate care in overcoming health challenges. Section 7. Prevention is key. While we wait for the test results, the doctor continued, shifting the conversation towards preventative measures. Let's discuss ways to prevent the spread of infection. "What can I do?" the patient asked, eager to take control of the situation. "Good hygiene is crucial," the doctor emphasized. This includes frequent hand washing with soap and water, especially after using the restroom and before eating. Avoid contact with rodents and insects, and make sure to cook your food thoroughly. "I'll definitely be more cautious from now on," the patient affirmed, nodding in understanding. Section 8. Staying positive, staying informed. "That's the spirit," the doctor said, offering a reassuring smile. "Remember, knowledge is power. The more you understand about viral hemorrhagic fevers, the better equipped you'll be to protect yourself and your loved ones." "Thank you, doctor," the patient said, their voice regaining some of its earlier strength. "I feel a lot calmer now, knowing that there are things I can do." "And remember," the doctor added, "don't hesitate to reach out if you have any further questions or concerns. We are here to support you every step of the way." Section 9. A doctor's reassurance. As the patient left the doctor's office, a sense of cautious optimism washed over them. While the possibility of viral hemorrhagic fever was a daunting prospect, the doctor's calm demeanor, clear explanations, and emphasis on early detection and treatment had provided a much-needed sense of hope. The patient knew that the journey ahead might be challenging, but they were determined to face it head-on, armed with knowledge and a newfound appreciation for the importance of prevention.